Now to a morning original. These are stories you see first and only on Wake Up Central. And a brand new report today is shedding light on critical issues facing Arkansas's children in hopes of finding ways to fix them.
Now, it has been months in the making by Arkansas Children's Hospital, and the report has some eye-opening findings. Wake Up Central's Mikaelyn Johnson is here with what it found. Mikaelyn?
Good morning, Hayden and Karen. From parents and caregivers to stakeholders and community partners, Arkansas Children's connected with hundreds of people for this assessment. They used focus groups to form loads of data for an accurate tell of what children in the state go through. Issues that came to the forefront, behavioral and mental health issues, and for the first time, child abuse emerged as a top concern.
To identify how we can go about best supporting the children of Arkansas.
It's called Community Health Needs Assessments, or CHNA. These assessments help move the needle on child health as they uncover current disadvantages plaguing the state's youth.
We need to know what the priority and those things are that children actually need to support their health care.
The CHNA is completed every 3 years and takes around 9 months to gather all of the data and to complete the analysis. And once that's done, they have what is called primary findings and secondary findings. Primary findings show issues in behavioral and mental health, food insecurity, as well as immunizations. Partnerships Director Sharonda Love credits this to the pandemic.
We've definitely seen an increase in the need for mental health and mental well-being. We also know that our families have been in more than they've been out and maybe not had an opportunity to go and see a doctor and get those regular childhood immunizations.
For secondary findings, one has been an issue in the past, but for the first time, it's risen to the top.
Child abuse. We really need to make sure that we're able to focus on that and find how we can best support children and families.
The analysis also finds disparities across the natural state. Disparities in location. Rural areas have less access. In health, minority children face more disadvantages, and also in economics.
Making sure that there's access in healthcare, housing, food security.
The CHNA is just the first step. Up next is implementation to make a valuable shift in the disadvantages Arkansas youth face. One way that Arkansas Children's has been able to implement what they learned from the CHNA is through their School Nurse Academy. They work with school nurses to provide training to directly provide services related to the issues identified in the report with the goal of improving the lives of children all across Arkansas. Mikaelyn Johnson for Wake Up Central.
Mikaelyn, thank you. And now that we know what's in the report, and it is disturbing, let's talk more about what happens next.
We are joined by Marisha DiCarlo, Vice President of Community Engagement, Advocacy, and Health for Arkansas Children's. Thank you so much for waking up this morning, joining us. So this report is coming out, obviously focuses on kids with everyone going back to school. Yeah. The main emphasis that we're seeing for families right now.
Yeah, absolutely. This report really kind of highlights some of the most important issues in child health right now, and what's emerged from that, as you heard, is behavioral and mental health, back to school immunizations, those early childhood immunizations, and how important vaccines are, food security for children and families, and then also for the first time ever, we've heard about the importance of us paying attention to and making a difference in child abuse. So child abuse prevention is going to be really important for our state.
It is. Here are the priorities that they're looking at. Everybody, you can take a look now, and the question is, now that we know this, you don't just stop there. There's an implementation plan that we'll follow. Tell us about that.
Yeah, absolutely. So you're right. We don't stop here. The next step is really to form an implementation plan. That implementation plan is something where we and partners around the state really look at ways that we can make a difference in communities. We take the learnings from this assessment and then see what steps do we want to do? What do we want to address next with communities together?
You talk about addressing that. You know, this information is out there. Parents can look at it. Everyone can look at it. What's the drive? How do we get this going to make these changes?
Yeah, absolutely. Well, first off, I'd encourage everybody to check out the report. It's at archildrens.org/CHNA. And from there, the information is broadly available so partners and communities can really wrap around that information and take the next steps to address those issues.
And you brought up a good point about the community getting involved. Now that we know this, we can't unlearn it and know that our children are suffering in this way. What do you recommend?
Yeah, absolutely. You know, there's so much power in community, and I think that people coming together, partners around the state, really trying to address these issues is what's going to make all the difference.
So another question too for you, what all went into making this report and getting all this data and information out to folks?
It's quite a big process, actually. So we have talked with over 800 people. So there are focus groups, stakeholder interviews, surveys to really gather information from parents, community leaders, healthcare providers, just a variety of stakeholders. And then there's also that secondary data. So all that stuff that's gathered about Arkansas health issues that are reported to the state and federal organizations that we have taken a look at.
This is a little bit more of a personal question. I'm not a parent, I'm going to be. So I'm going to be expecting a kid in February. So if I'm going to be a parent, I want to get involved, how can I do that?
Yeah, so I think that that's really important. First off, just the situational awareness, to know that these are the issues in the state, and then to see how you can connect with organizations that are making a difference. And again, archildrens.org/CHNA is how to get this information and the data.
All of that you found is disturbing, but getting it out there, once you're aware of it, makes it, but how do you know where to really hone in on?
Yeah,
with funding and such?
Oh yeah, I think that that's a great question. So I think that a few things, I mean, it's important to take a look at what resources are available in particular areas and what you're really interested in engaging in. We know food security is such a big issue, so there are lots of folks working on that. Engaging with food pantries and other organizations is just one example.
Well, it's not just this week, not just next week. When kids go back to school, we feel so highlighted to talk about kids. Thank you so much for being here and for doing this and highlighting this important issue. We so much appreciate it.
Thank you for talking about it.
We wish you all the best, and folks, you have heard it as well. You can find out more. Give us that website one more time, please.
Sure, it's archildrens.org/CHNA.
Okay, got it. And we'll link our story to the website as well. We thank you so much.